Hi guys, we're back. It's me and my sister Julie. We're talking about another health topic today, to expose people to new modalities that they may not have ever tried or maybe not have even heard of. This next one is one that I didn't know about before, and it's called somatic therapy. And so Julie has had several sessions so far, and I was hoping that she could explain to us what it's all about, what makes it different from other therapies, etc. So, Julie, what made you decide to try somatic therapy, and about how long have you been doing it now?
Well, my doctors recommended that I do some sort of therapy just because of some of the health crises that I had been through the past 18 months to 2 years. And I was open to that, dealing with some anxiety on top of everything else. And so thought that anything extra that could help would be beneficial. I did start out with kind of a traditional therapy, like they call it CBT therapy, cognitive behavior therapy. And I went a couple times to that one. I liked the therapist just fine, but it felt kind of like homework to me. And not that it's not a good type of therapy, it didn't feel right for what I was needing at the time.
Yeah.
And so I talked to the PA that I was seeing and asked her if their group had a somatic therapist and if she was familiar with that. And she was, but their group did not have one. So she was open to me finding one. We have several in our area. Kind of overwhelming to choose from. But there was one that just kind of resonated with me, her description of things that she works with, and then also her pictures. Sometimes the pictures go a long ways where you're like, oh, I could relate to that person.
Yeah.
And so, yeah, it was, so I tried her out. She also took my insurance, which was a bonus.
Yeah, for sure.
And so one of the things that I liked was right off, she said, everybody maybe resonates with someone differently. And so if, we got a couple sessions in and I wasn't necessarily getting what I wanted to get out of it, to let her know, because she knew a lot of other therapists in the area
Oh,
and
that's
had worked with
cool.
quite a few. And so she was open to, making a suggestion
Yeah.
if the fit didn't seem right. So I liked that. But the reason I looked up or looked into seeing a somatic therapist initially is because it deals a lot more with emotions and your body, the theory of your body holding on to emotions and not processing them correctly, whether it be as an adult or more commonly from childhood, that we don't even really necessarily think that we haven't processed those
Mm-hmm.
emotions, but then later in life they yield physical symptoms or problems. And so I thought that that was kind of an interesting concept. And a lot of people don't like the idea of like talk therapy. They don't want to talk about things, or they don't think they have anything to talk about. And so this kind of alleviates that tension because you don't really have to talk about things.
Mm-hmm.
What they focus on is what you're feeling in your body. And I have, with some of the physical things that I've been dealing with, I have a lot of physical sensations in my body that aren't really making sense to the traditional and conventional doctors. So she would mainly ask, what are you feeling in your body today? And so it might be something in my legs or something in my head, or, tingling or an ache or something. And so what she would do is either have you hold a position or touch that area, or even a slight exercise that involved that area. And what was interesting is you didn't even really have to talk. She might say, so what comes to mind? Like, say it was something in my head, I felt like tingling in my head or something. So she would have me touch that spot of my head.
Mm-hmm.
And then she would say, is there anything that's coming to mind when you're touching that? Or are you feeling anything different? And so then I could say, oh, this came to mind. And then she would say, now, did the sensation that you were feeling change, or did it move? And, sometimes it would and sometimes it wouldn't. But what would ultimately happen is, as she would kind of guide you through what your body was feeling, a lot of times a thought did come up or an emotion did come up. And so when you talk about that, you don't even necessarily know why an emotion came up. You might say, I feel discouraged or sad or whatever, and you don't even know why. But as she talks you through it, you can kind of process that emotion, and it comes out differently for everybody. For me, I'm kind of a crier, I guess, but
I am
not in
too.
life, but
Yeah.
in that like kind of setting and session. Also, like, I'd have to blow my nose a lot, and so we joke like about having a Kleenex shower, and
Yeah.
but she said when she sees her therapist that hers comes out in belching, and that
Oh,
she's had other people that
I think
come
I would
out.
rather be crying than burping.
And she
Funny.
said she has other people that like come, theirs will be like shaking or hiccuping or twitching or and so everybody's a little bit different,
Wow.
but it's helping your body like process those pent up emotions that we
Yeah.
haven't really dealt with
Yeah.
at a cognitive level, I guess.
Yeah.
And it's not always like a rational like processing. It's just your body, like we might as adults or as children, just as a coping mechanism, bury an emotion instead of deal with it. And so this helps your body just kind of deal with it and get rid of it, whether you're fully aware of it or not. So it's kind of a neat thing. I've really enjoyed it. We do have sessions that are totally normal where I just kind of talk about my week, and nothing crazy comes out of it, like a ton of crying or anything, which is nice too. But it's an interesting theory, and I also like that it doesn't feel like work,
Yeah. Yeah.
So and
There's no
also
homework. You have
for
to go
people
home
that
and do
might have
later.
had difficult situations that they don't want to talk about or don't want to relive, they really don't have to. Their body does it for them.
That's really cool. Yeah, no, I'm one of those people. I don't really like to go into the details with someone I don't know, and so yeah, I like that idea. Now does she ever touch you like in certain spots while you are processing, or is it only yourself?
It's only yourself, at least with this practitioner. I have read that there's other practitioners or types of practices where they will facilitate that,
Mm-hmm.
or whether it be even a pose or an exercise. They use like
Mm-hmm.
different poses
Mm-hmm.
to, and may or may not be aware of. I'm sure you are aware of that. Um, Somatic exercises a lot. There are a lot of like yoga like poses or
Mm-hmm.
movements when you're doing a somatic exercise session, and so they'll sometimes she'll put me like in a pose to hold for a while, um, or things like that. But no, this particular practitioner doesn't ever touch her clients. But
Gotcha.
like I said, it sounds like from what I've read up on that some do. It just depends on what
Mm-hmm.
type you want to be involved in or what you're comfortable with. And like I
Mm-hmm.
said, she initially said, if this isn't what you're looking for, let me know, because I know practitioners that do all sorts of different things.
Okay.
So it's
So there's
not kind of a one size fits all.
yeah, there's a wide variety of techniques within the somatic therapy world, apparently.
Correct.
So I know when I told you that I had one or two sessions and they were virtual, you were like, "Oh, I think in person would be better." But now I'm curious because it's not like the practitioner is actually facilitating by touching you on any points. So why
Right.
did you feel like virtual wouldn't be as good? Just curious.
I think just because of the, what would be a good term, comfort of being in a place that you're not as familiar with, like
Mhm.
for instance her office setting, she makes it very comfortable, dim lighting, you're
Mhm.
sitting in a comfortable area and position, and
Mhm.
like it's not at home where all your stresses are, and you
Oh,
don't have
gotcha, gotcha.
distractions and things like that going on.
Okay.
And so for me, I feel like that's a better setting for me. But I could see
Mhm.
if you were in a situation or in an area where you weren't able to see somebody in person,
Mhm.
that it could be, still very beneficial. And that kind of goes along with the somatic stretching and exercising. There's lots and lots of YouTube videos or apps and things that go through somatic exercises to help you
Mhm.
kind of get those emotions processed on your own. And obviously you would do those at home for the most
That's pretty
part.
cool. Yeah, no, that's great. Yeah, so like, it seems like you're the kind of person that doesn't really mind going running errands and going to appointments. Whereas, like, I know myself, I'm a homebody. I don't like having to be scheduled to the hilt and make appointments and run into town and all this stuff. And so, having virtual option is really cool. Or for somebody that like really stresses out, deals with social anxiety or something like that, to just do it in the comfort of your home is nice. But I see what you're
Yeah.
saying too. Like when you're there, you're like in a therapy mode because you're in a different environment.
Well, and there were times that it would definitely have been easier for me to do it at home just because of some of the mobility issues I was dealing with. I was having difficulty getting from my car inside a building or whatever, and
Mm.
she's in an upstairs
Oh
studio, and
yeah,
so I would have to
that would be
take their
harder.
elevator up, and sometimes I could go up the stairs, but after the session, my body would be so shook up I'd have to take the elevator down.
Wow.
And
Yeah.
so there's definitely in some circumstances where a virtual could have been better, but I was also in the
Yeah.
situation where I wanted to force myself to be out. So
Yeah. That's good. Yeah.
yeah.
So not to change topics, but I do have a lingering question from something you said early on. You said CBT, cognitive behavioral therapy, felt like homework. Can you just touch on that just so I understand why that felt like homework?
Well, and to be honest, I did only see that therapist probably 2 or 3 times, but
Mhm.
um, one thing that I didn't love is she wanted to focus on like one aspect of um, like physical issues I was having. For instance, it was insomnia.
Mhm.
And so to focus on specifically that versus kind of all of the stuff I was manifesting. And so, like, she wanted me to change my bedtime routine, which had become kind of a bonding experience. I used to stay up late, and I got to where, with some of the things that I was going through, that just for comfort level, even though I wasn't sleeping at all, I would go and lay in bed with my husband and like read.
Mhm.
Well, he would kind of read and then he'd fall asleep early, and then I would just kind of lay there all night. But
That's
she
sad.
wanted me to stay up and not go to bed at the same
Oh,
time and stay up and read, and then just stay up until I got so tired that I had to go to bed. Well,
wow.
I never did get tired for like a year and a half. And so
Wow.
I
Miserable.
tried it, for a little while, but then I was losing kind of that bonding
Mhm.
experience of just kind of going and unwinding and laying in bed with my spouse.
Mhm.
And then she said, if I woke up and was up for couldn't go back to sleep after say 20 minutes, just to get up and go sit on the couch. Well, that kind of prompted a little bit of post-traumatic stress for me, because while I was going through a period of weakness in my legs and problems with mobility, I had fallen a couple of times because I would get up in the middle of the night and come to sit in the living room,
Yeah.
and that instigated falls, and so that was a problem.
Yeah. Yeah.
So I
Gotcha.
was just like, when I told her that later, after I tried it for like 2 weeks, I was like,
Mhm.
I just can't wrap myself around this, and she was like, well, that's okay. And I'm like, it just feels like I'm getting assignments, and that
Yeah.
wasn't what I felt like I needed.
Yeah, exactly. And then internally you were resisting because of various reasons. So yeah,
Yeah.
that makes sense. No, I love it. No. Okay, well, we'll move back to somatic therapy then. Thanks. Um, just curious, did she ever have you like look in a certain position with your eyes when you
Yeah.
were recalling a memory or something?
Yeah. Or she
Yeah.
would maybe notice if I did something, with my head, or with my eyes, or if I ask if I noticed, but yeah.
Mhm.
But
Yeah.
she doesn't specifically deal with the EMDR, which is an eye movement therapy,
Oh,
but she's worked with therapists that have used that along with somatic therapy.
what was that called again? I didn't catch it.
EMDR, it's an
Eye
eye movement
movement.
therapy.
Yeah, therapy. Okay, very cool. Yeah, so I only had 2 sessions as well, and it was virtual, just like we're doing right now. And when I talk, oftentimes I look up off into the distance, and I just like my eyes goes off somewhere, and she noticed that, and she's like, "Stop right there. Put your eye back where it was. Now tell me what you were feeling in your body." And I'm like, "No, no, it's just a thing I do." And she's like, "No, that's where your memory is stored." in that specific spot where you're looking. And so
Yeah.
I found that pretty cool.
Mm-hmm.
Um, and then, yeah, same thing. She said to just like, you know, describe what I'm feeling and then just sit with it like as if you're at a movie theater watching a movie. Don't try to change it because, like, when you're at a movie, you can't change what's happening on the screen. You can
Mm-hmm.
only sit there and observe. And so, sure enough, I have to admit, I was observing and I told her, well, the pain is kind of in my neck, and then it traveled down and went out into my shoulder, and then it just disappeared. It just like completely just vanished. And she could even tell when it disappeared by just watching me as I was,
Mm-hmm.
expressing it. Um, and so that was really pretty cool. Just observing it made it feel acknowledged, and then it went away. It
Mm-hmm.
was it was very unique.
Mm-hmm. Yeah,
Yeah.
it's kind of a neat modality, and like I said, I don't know if you felt the same way, but for me, I don't always even have to articulate or understand what the feeling is or where it's coming from. It's just that
Okay.
your body is resonating with something, and then when it's gone, it's gone. And it doesn't mean it's going to come or not going to come back or come back in a different area, but you
Mhm.
can work through it and release it from that area, and it's a neat thing.
Yeah, no, that's really cool. I never did feel emotional, like you were saying that sometimes you'll cry or whatever, but maybe just 2 sessions wasn't enough to, like, get enough layers dug out of me.
Sure.
I'm not sure. But, how did you feel after your sessions? I know you said you had to take the elevator sometimes. Did it, like, deplete you? Like, "Ooh, I just, like, I've released a lot."
um Not necessarily deplete me like where I was really tired afterwards or like had to go take a nap or anything, but I
Mhm,
would definitely feel it physically. And
mhm,
some of the issues with my legs, which I think we talked about with the foot zoning, there's emotions involved there.
mhm,
And so I would, my legs would get weak and shaky after a session. And she would always, we'd do some grounding exercises afterwards, which would get me better, but
uh-huh,
I'd still feel a little weak for a while,
yeah,
as far as, movement, moving around, things like that. But yeah, even like I would get really congested, and I laughed the last several times that I've gone. I would be like super congested to where I couldn't even do the deep breathing through my nose.
yeah.
But I'd get out to the car, blow my nose, and I'd be totally cleared up. And
That's
so
cool.
it's
Did
kind
she
of
ever
interesting.
did she ever explain why that happens? Because I'm working with a different therapy modality we'll talk about maybe next time. And there's a lady that always says the same thing, like she needs tissues brought to her and she can't breathe through her nose during a session.
Yeah, well, like I mentioned before, she said everybody kind of releases things differently, and and she's like, maybe yours is just mucus. So, who knows?
Yeah,
But
getting all that
um,
crud out of your head.
exactly, yeah. So, and that's when she brought up that hers was belching. It comes out in air, and
Oh
so
yeah. Yeah.
yeah, everybody's body just kind of holds on to things differently, I guess.
Okay, gotcha. Somebody asked me the other day what your favorite modality has been so far, and I felt bad because I couldn't remember. So, out of all the things that you've tried, what do you think has been the most impactful so far?
um, that's kind of a hard question, just because prior to my last 2 years, I would say auricular was my favorite, but because it was the only thing that I've done where I could feel my body completely relax. And I used to tell
Ear
people
therapy.
that it was yeah, the
Yeah.
ear shock therapy.
Yeah.
um, it was the only thing. I mean, I've had massages like crazy. I've had different kinds of body treatments and things like that, but it was the only thing that made me feel completely relaxed from inside to outside.
Mhm.
Now, in dealing with what I've gone through the last 2 years, he
Yeah.
actually referred me to the gal that does the foot zone work. And I would say that's my second favorite because I've seen um, such a change in what I would feel that when I first went, and
Uh-huh.
even what I would express when I first went,
Hmm.
as far as emotions and things like that, till now. And would I say it's completely healed me? No, but it's brought me a long ways. and
Yeah.
and I can feel the difference as she works my feet in the different areas.
Yeah.
So that part is really cool. But to be honest, like I really like all of them. There's not one that I don't like.
Yeah.
The colonics I had a blast with, and I still see her as a maintenance,
Mm-hmm.
not as often anymore. There's another therapy that we'll talk about in the future that I'm doing that, it's just really relaxing, and you do see changes, physical changes as well. And so it's neat to look into these different things. And I do think that they all work together. The
Yeah.
things that I've
Sure.
been doing, they work different in different ways, but they all work together.
Yeah, I love that. Would you say that the foot zoning was more of a emotional therapy than a physical, as far as like what you noticed
No,
as far as
I would
changes?
say on the surface initially, what came out or what I noticed the most was emotional, but the long term continuance of it has been definitely more physical.
Okay. Like what? What is what's an example? I know we're switching topics
For
again.
instance, she's been working a lot on my lymphatic system, and I
Mhm.
can feel a difference in the areas that she works. I can, like, they're
You did
not
say
nearly
you're
as sore
losing.
now.
You said like your pants are getting really loose. Would you attribute that to a physical manifestation from foot zoning?
Um, that I feel like is a combination of the colonics, foot zoning, and the spinal flow,
Okay, gotcha.
actually, because they're all
Yeah.
kind of changing your body in different ways.
Oh,
Um,
wow. Okay.
I noticed it initially with the colonics, but
Okay.
uh, like with the spinal flow with which we haven't talked about yet, but with the
Yeah.
pictures, you can see how the body
Yeah.
stance has changed, which changes how your clothes fit.
Oh, that's
And
yeah.
with the foot zoning, getting my lymphatic system working, she's working my vagus nerve a lot. She's
Mhm.
working my hypothalamus, pituitary gland, and there's
Mhm.
one other that are all supposed to communicate. And initially, they weren't communicating at all. And now I can tell when
Cool.
she hits those certain spots that, like, it feels different. And so I'll ask her, are they communicating better? And she's like, no, not completely, but they're getting there.
Yeah.
And it's funny where I can feel a difference when she works
That's
those
so
areas.
cool. That is so cool. Okay, so then circling back to the somatic therapy, it seems like you mostly talked about emotional releases. What about the physical response there?
I have neuropathy in my feet, which is manifest mostly by heavy tingling.
Mhm.
Um, and I have noticed a difference with the somatic therapy. Initially, it was my foot zone practitioner that said, the problem with your legs is not what the neurologists were telling me. She said it's emotional.
Mhm.
And so that kind of has always stuck with me. And I saw that manifested mostly in somatic therapy, just because of, like I said, after our sessions, sometimes my legs would be like nearly non-functional until
Wow.
after a couple hours,
Yeah.
and that was able to process through. Um,
Interesting.
and over the course of, I've probably seen her 10 times.
Mhm.
Um, I can see my mobility's gotten a lot better, even though I haven't been, like, it's been cold here and such. And so I haven't been doing a lot of outdoor walking and stuff like that, like I would
Yeah.
like to. But I have noticed definitely being more mobile and less problem with my feet.
That's so amazing. That's so interesting. I would not have guessed that. So you did mention that she sometimes helps you get grounded before you leave your appointment. How does she do that?
Well, you're familiar with grounding pads and things like that. I know
Yeah,
in
I was just
outdoor
wondering, are you
grounding.
actually standing on a pad or?
No, but what she will do is, like, sometimes she has me take my shoes off, or sometimes even my socks off, and then we do different, like, either rubbing or stomping or tapping or things on the floor.
To just
Um,
connect yourself.
yeah,
Yeah.
to
Okay.
gain that connection back.
Okay.
And
Gotcha.
I think if she were on the second floor, she would totally take me outside and make me walk around in the dirt, which,
Yeah.
if you've never done that and you're feeling disheveled, do it. Go walk around in the grass barefoot. It really makes a big
Yeah.
difference. But so
Yeah.
there are things that I'm familiar with already. But
Yeah.
since she's second floor, we do what we can.
Yeah.
But it really does make a difference when we spend 5 minutes grounding at the end.
I love that. That's actually a great idea for, I mean, maybe a short video in the future on just how can you ground at home, different methods, and why it's helpful. So yeah,
Hmm.
it's a good one. Okay, so we touched on the physical, the emotional. We touched on kind of what therapy is actually like, and that it's actually, you're actually seeing benefit from it every time
Hmm.
improving. Have you ever gone to one of the sessions and actually went backwards, like felt worse afterwards?
No, no. In fact, it's made me think how beneficial it would be for certain people in my life, even young ones that have gone through
Yeah.
traumatic things that maybe don't know how to articulate what
Mhm.
they've been through. This kind of therapy, you don't have to worry about them guiding you the wrong way,
Yeah.
or making you think something that isn't your truth, or
Hmm.
um, because you're basically just manifesting and feeling what's in your body and
Yeah.
then helping that be released. And so I like the idea of therapy, because some people think you go to a therapist and then you're ingrained with their ideas. And
Right.
this is like the total opposite, because they're not telling you anything.
Mhm.
They're letting your body tell them what's going on.
Yeah, no, I love that explanation. That reminds me of something I was just listening to last night about the difference between our thinking brain and our subconscious brain. And so it seems like somatic therapy is tapping directly into your subconscious. And that's where the subconscious will store away traumatic events and different things.
Well,
Um,
and it comes out physically. We manifest those things physically, whether we realize it or not. Like you were
yeah,
talking about looking up,
blockages.
a certain direction, or maybe it's something we do habitually, like clearing our throat. I read something
I
recently
clear
about
my throat all the time.
things like that, clearing your throat, or
I'm
different
just
little
releasing.
ticks that
Never
you
mind.
have, like, pulling at your hair, or
Yeah.
itching your face, or, yeah, biting your fingernails, different little things,
Yeah.
um, that your body is manifesting to process, or deal with those emotions. And
Hmm.
what the somatic therapy does is help release those so they're not stuck there.
Nice. Nice. I love that. Yeah, I know the somatic therapist I saw, she did say that she felt like, well, she said it could change you. Like, even though you're feeling all these things right now, social anxiety and, just all this stuff that I told her, she's like, after you do enough somatic therapy sessions, you will basically be a new person in the sense that
Hmm.
you won't, those things will go away. They won't even plague you like they are now. And
Right.
that's
Well,
pretty bold, proclamation, but it makes sense, I guess, because you're only viewing the world through how you perceive it right now, and if it's full of blockages and traumas, then that's like the glasses you're putting on and seeing the world through.
and I just think about the young people that today, what they're going through, and they have such a different environment that they're growing up in than we did.
Yeah, for
And
sure.
their outlets are completely different. They're all electronic, and they don't
Hmm.
really relate to really the human connection and
Yeah.
themselves exactly. And so I feel like it would be a good modality for anybody, whether they're having
Hmm.
issues or not, to go through, so that they can become aware of what they're feeling in their body and be
Yeah,
able to process that.
that's a really good point. Yeah, I was also imagining like people, like a certain relative of ours that doesn't like to talk about any emotions or communicate much. That kind of person could probably
Hmm.
really benefit with going introspective and being aware of their body.
Hmm.
Um, and then, like you say, for kids, what a great gift that would be for parents to send their children to somatic therapists as an ongoing kind of maintenance so that these traumas and blockages don't build up over
Hmm.
time. And we just take care of them as they happen because we can't escape them. They're always going to happen to us. But at least if you could have a maintenance program to keep eliminating them throughout
Hmm.
life, wow, that would be amazing, right?
Yeah, and they don't get stored, and then we don't get struggle with not knowing what to do with these feelings that we have, that we don't know what they're from,
Yeah,
but our
yeah.
body knows what they're from. So I know people that you were talking about that don't like to discuss emotions or acknowledge emotions, but that's
Mhm.
why I think this is a great modality, because you really don't have to. Same with
Yeah.
the foot zoning. I think I mentioned in that one that
Mhm.
um, the therapist had said there's a gentleman that comes that he'll tell her, just work my feet, I don't want to hear a thing. And and like the old cowboy style.
Yeah.
And I mean, that's how a lot of people are. They don't want to like process
Yeah.
or deal, but this kind of thing, you're not having to acknowledge the
Yeah.
actual emotion, you're just letting it go.
Yeah. That's so nice. Yeah. Just don't even make the frontal brain work, right?
Right,
Just
right.
deal with it, the subconscious part. And I love that. Well, cool, Julie. I loved this. This was a great interview. I learned a lot from you. And
Good.
do you have any like other thoughts as far as anything else that we didn't cover that you'd like to share?
Well, I guess the only thing would be, I mean, even I've been there before where maybe you have a kind of an idea about what you think therapy would be, or,
Hmm.
I don't need that kind of thing, or I wouldn't be comfortable with that. The somatic therapy is completely different, and I would recommend try a session. It's not going to hurt.
Yeah. Insurance
It's
covers
not
it
going to
most
hurt
of the time.
anything. It could help something. You might hate it and never do it again. You might love it and it could change your life. So,
Okay.
and you don't have to worry about, them changing, the therapist changing your core views or values or beliefs.
True.
It's just helping you, and
That's
so
true.
to me, that was kind of an eye opener. And I'm glad that I was able to stumble upon that particular type of therapy and was
Yeah.
able to use it.
I love that. Well, thank you for that. That's a great recap. And yeah, this has been
Good.
fun. Um, if anyone ever does want to reach out to you, are you comfortable with that? And
Sure.
if so, what method would you like them to contact you?
Just through you would be fine.
Oh, okay.
Yeah,
Sounds
I'm on Facebook and Instagram and have a cell phone, so yeah.
good.
But yeah, I'm pretty open with what I've gone through and what I've been through and what I like to try, and
Yeah,
why I try different things. And
yeah,
there's some things I don't continue with, and sometimes some things that I do or would like to, and so
yeah,
yeah.
yeah. I'm not sure for myself. I'm not sure if I'm going to continue the somatic therapy. I've only done 2 sessions, but I didn't really feel very different afterwards. I guess that's one lingering question I want to bring up is, do you feel like it takes a certain number of sessions before you really notice anything, or did you notice something right away?
Um, so with the first therapist that did the CBT, like I said, I did like her as a therapist or as a person. I didn't like the technique, and so
Okay. Okay.
I wasn't ready to quit after two, but I wanted to try a different type. And
Okay.
I do think, to a certain extent, especially like you said, you weren't really like wanting to delve really deep initially.
Mhm.
Maybe have to have more of a connection with your therapist, that more sessions would be good, or maybe a different therapist altogether, or
Mhm.
even in person versus virtual, or vice versa. If someone's in person and they don't like it,
Yeah.
maybe virtual is better for them. So, like I said, I've been about 10 times. I do plan on continuing it
Yeah.
for a period of time. I don't know how long, but
Yeah.
I have found it helpful.
Cool. And you made a good point too. Is there's nothing stopping me. Like as long as my insurance covers it, I might as well try another therapist and another one, just a couple, just to see which
Mhm.
one's technique I like best.
And
Yeah.
there's part of me that would like to try some different somatic therapists just to see their style
Yeah,
and what
exactly.
they
And
do. Hmm.
personality and all that stuff. Yeah,
Yeah.
I love it. Well, cool. All right. Well, thank you so much again for your time today.
Yeah.
Always enjoy these and have a wonderful weekend.
Thanks. You too.
Okay, bye.
Bye, everyone.